Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 39 of pregnancy. So some new signs and symptoms you might be having are all kind of associated with actually going into labor. So at this point you might notice that your water actually breaks. So what it's going to happen is you're just going to feel this kind of rush of liquids. Can be a lot, can be a little, depends on the person, and these are signs that you're actually going into labor. Another thing that you might notice, your OB might start to do kind of cervical exams. So what they're checking for are you dilated at all, or are you effacing? So what effacing is where your cervix is actually thinning out. So typically they give you about a percentage, whether it's 10%, 30%. The closer you get to 100, the thinner your cervix is. So the more prepared you are and the more things are closer to going into labor. So you might notice that at this point your OB might be checking those things to see how close you are to going into labor. So what's happening with baby this week? Technically this week baby is considered a full-term baby, so if birth happens, everything's great with baby. A lot of people tend to think that after 36 weeks baby is considered full-term, because if at that point you go into labor, they're not going to stop labor, where baby isn't considered full-term until actually 39 weeks. So like I said, at this point they're actually considered full-term, and if delivery happens again, that's great at this point in time. Another thing is that their fingernails are all the way fully formed, so whenever they come out of the womb, you'll notice that they have nice little baby fingertips. Another new thing that's happening is that they're forming new skin cells. So like an adult or like a child, our skin cells kind of let go and slough off little by little, and new skin cells come behind and form. So that's what's happening with the baby right now, is they're forming new skin cells. So this week, baby is roughly the size of a mini watermelon. So they're about 20 inches long and about 7¼ pounds. So if you have any questions about this, about labor, delivery, about how we can treat the baby after he's born or she, give our office a call. Thank you.